My name's Ollie Chandler. I'm Head of Technical Services, part of the leadership here at Milton Keynes University Hospital. We have a main hospital campus that's ever growing, as well as a number of up and coming remote sites and existing sites.
I'm Debbie Phillips. I'm the Chief Clinical Information Officer at Milton Keynes University Trust. I'm also a consultant surgeon, originally a vascular surgeon and more recently an emergency surgeon. Wi-Fi at the Trust, it's everywhere really. I can't imagine how we would manage without it. So everything from our electronic patient records. We have a number of other clinical systems that are also rely on the internet. So our radiology system, our PACS system, document management viewer relies on that as well. All of these rely on being able to connect to the network.
My name's Dean Bergin. I'm co-founder and managing director of Boxx Communications. We specialise in internet connectivity and telephony services for businesses.
So challenges in terms of connectivity have been a long-standing issue for the hospital. We had many months of users having to wait for things to buffer, as well as holding up some of the cloud aspirations we had.
The hospital was waiting on an order with an alternative provider, which had been in delay for some 7 months. The impact of that was delaying some fairly significant cloud and digital transformation projects, and that was going to be patient impacting. He gave me clear requirements. It had to be delivered within less than a month, and there was no real negotiation on that. Anybody who works in this industry will tell you that delivering any lease line, regardless of capacity, in less than a month is broadly impossible.
They worked with us from the outset, and within an unbelievably tight time frame, we were able to solve literally overnight all of those problems.
We chose CityFibre for a few reasons. The first reason is that they were on net, so that meant that there was fibre going right into the campus. But more importantly, it was about culture and the type of businesses CityFibre are. Their mission is to deliver full fibre connectivity to the whole of the UK, and they absolutely believe that healthcare and public services should be at the heart of that.
We run a number of critical services now from the cloud that directly deliver services to staff to be able to treat patients.
If you're a patient and you're sick and you're in bed, but you're well enough that we'd like to share some of your information with you, or perhaps show you your scans, that can really help explaining. Or the other sort of Office 365 tools that we use, again, that relying on us having a good network, which have been transformative during the pandemic, but have carried on into the way we work now. So all the Teams meetings, saving staff having to come from other sites, much easier to share information and other things that people are working on. Sharing of analytics through things like Power BI, knowing again that users can look at that on whatever platform suits them. All of this just wouldn't be possible if we didn't have good connectivity, and to know that we could get that data anytime, any place. Anything that helps that is a really good part of good patient care.
We regularly meet with the IT team and just brainstorm and discuss holistically what the roadmap looks like for the hospital.
When there are problems, you need somebody that you can call up who you know has got your back. And that's something we really feel we found with Boxx. Because they are part of the community and they're building services in and around Milton Keynes, they're part of the same journey that we're on to deliver technology.
We're already now talking to the hospital about plans 4, 5, 6 years in the future. That's really exciting for us to be involved in.
We've got a number of other ambitions for community-based services in and around Milton Keynes, and that's really exciting and opens up opportunity to develop healthcare solutions based on technology, as well as really improve the quality of people's lives within Milton Keynes.